Okay, wonderful. Thank you, everybody. Let's take a couple of minutes or a minute before starting. This is a free market road show, and this is the Rome edition. We started early May when the lockdown started, ahead of the fact that we could have not meet in Rome. So we decided with Barbara, why not to do meetings online and using the technology we have available today and the platform we have available to go online. As it was not really an original idea because now everybody's doing meetings online. But the good thing is that with the Free Market Roadshow, we started in Rome, and now there's so many meetings going around, happening all around Europe. And as you know, we covered many very exciting topics that gather a lot of attention. We record these events and they are available forever. And as well, they are broadcast live on the Free Market Roadshow and on YouTube. As usual, I'm Pietro Paganini, meanwhile, guests are coming in. So you can follow the event, as many people do. They follow the event on YouTube, but don't forget that on YouTube, you can't make questions. You cannot interact with us. But if you come live on Zoom, don't be shy. You come live on Zoom and you can interact with our guests. And I said all topics are great and exciting. The topic of today, let's say, goes beyond the usual issues that we are able to discuss in our meetings. And it goes back to one statement that I usually carry with me from Disraeli, and my guests, I'm sure my guest speakers here are very familiar with that. There are lies, damn lies, and there is statistics. And today, in a way, we are going to cover statistics. And we start exactly from what we see every day. When we wake up all day long, watching the news, reading the news, it's about, for instance, the toll because of the COVID-19, because of the coronavirus, and all the different statistics, how many people are infected, where people are infected, why there are more people infected in the place, why Germany has a high number of infected people but a low number of death toll, or why in Milan there is so much people being infected, so much people being hospitalized, why so few in Rome or in the south. And now I'm in Rome and I can tell you, very few cases here. And there's been in the media a lot of speculation. There's been in the media a lot of talks. We have wondered, why is that possible? So today we try to understand this with three great speakers. One is Duane. Help me with your family name because I will never be able to pronounce.
It's Schulthess, just like you sneeze it.
Schulthess, so, easy.
Yes.
Then
yes.
We have, this is easier for me as an Italian, we have Laura Campos, and then we have Daniel Kaddik. And hopefully I pronounced that correctly, okay? So let me start with Daniel, and slowly during the hour conversion that, don't forget, lasts for 45 minutes. It's like a half-time football match, and unfortunately we can't watch football, but we do this. Some person asked me, why 45 minutes? Well, it was, I have to give you a trick. It's statistics, because I realized that within the 30 minutes people are following. When we get close to the 45 minutes, people get tired. Whatever you are talking about, they get tired, or they simply have other things to do. And we realize that after 30 minutes to 45 minutes, there is, thinking about data, there is a decreased participation, despite we have a hardcore number of participants following us. But Duane, let me start with you, because I'm not sharing that. If you want, I can do that. But you published an article that now, of course, I can find anymore. It was on my screen a few minutes ago and disappeared. But you wrote, your team in Brussels wrote an article on actually how to measure, or why there are differences, and correct me if I'm wrong, on data on COVID-19. Because if we look at the different countries in Europe, we notice very different numbers. And we can say, well, maybe people are more affected in the north of Italy than in the south, or in Austria rather than in Germany. But then we hear, and we read in your paper, and you can share the link, I will definitely share the link as soon as I find the paper, there were many checks done in Germany. Meanwhile, in other parts of the country, they didn't happen. I was surprised, because this was not in the media in Italy, that there was a city in Italy that you mentioned where there was a lot of checks, done. And in fact, the government or the government agency has decided to start checking a higher number of population. But there are areas in Italy where there's no checks at all. So would you like to tell us more about the paper and why data are so important?
Yeah, sure. Thank you very much. One of the things we do at our firm, which is called Vital Transformation, and one of our mottos is the data is the data. So we always like to look at data and try to let that guide our path. We don't like to come in with any predetermined opinions. And what we found interesting when you looked at a lot of the initial responses and initial modeling, I mean, if we go back to March and if we look at some of the initial models, if you remember, there was a bunch of studies that were coming out of Stanford University in particular, where they were looking at the Diamond Princess ship and saying, okay, well, if we look at this population and we look at the coverage and how many people died, and then we extrapolate this over the population, we would expect to see a mortality rate of about 0.5%, 0.4%, much lower than the 3% of the WHO. And people's heads exploded. They said, this is crazy. This can't be possible. And then if you look at what's happened since then, Stanford and particularly USC as well as Germany have done a lot of coverage exams looking at antibodies in those countries. And they are in fact finding that when you look, there's about 80 to 85% of the people who are getting COVID-19, the coronavirus, the Wuhan flu, whatever you want to call it, that don't present symptoms necessarily, or people just think they've got a cold or a flu. And in fact, they've had the coronavirus. And it's about 80 to 85% of cases. If we look at New York and what's happened in New York, if you are under 30 years old, there's literally a 0 in 100,000 chance that you will perish from COVID-19. So we were starting to look at a lot of these early studies, particularly the ones out of Imperial College that were anticipating 2.2 million deaths. And we saw an enormous variance between what we were seeing in the actual hard data from the Diamond Princess and what was coming out of some of these models, these graphic models that were fit models, what we call fit models, where you fit them to a curve. And so we started trying to develop our own modeling. I'd worked with Dr. Harry Bowen, who I've worked with on a couple statistical studies before, who used to be at the Department of Labor and Stern University and was teaching here at KU Leuven, where I did my MBA. And what we found was you couldn't really look at the data from a national footprint. You really needed to go city by city and really look at the variance in the data between cities and how each city and region was handling that. And we looked at amount of hospital beds, which of course everyone, ventilators, last month, this was the topic du jour. Oh, we don't have enough hospital beds per thousand. We're going to overrun our logistics. Amount of tourism. There was a big question around tourists. There was a big question about trips taken per day by public transportation. So we really took all of these variables in a multivariate analysis and threw it at the mortality rate. And what we found in our statistical model, which was quite a surprise, was that 86% of the answer of the variance in the model could be determined simply by testing and confirmed cases. So actually that answered over 80% of the model. And then population density was about 2 or 3% of the model. And so really what it came down to was how many of these cases, these more severe cases, were you capturing? How are you managing that? And then how are you able to control the spread of the disease? And if you look at what's happened in Sweden, they've had a very hands-off approach saying, look, we're going to keep the over 70s isolated, but we're kind of just going to let this run because there's really a nominal risk factor here. If you're under 50, I'm 53, I'm on the bubble. I've got about a 2% chance. Okay, not great, but I'm willing to roll the dice. But for those over 60 or over 70 with pre-existing conditions, that's a problem. And in Sweden, they've tried to isolate that. And Sweden's roughly the middle of the pack, but they've got roughly 30% coverage right now in herd immunity. That's what you also see in New York. So there's been multiple approaches, and what we found was you could really predict mortality, the mortality rate, by the amount of testing and the amount of confirmed cases that you had. And the more aggressive testing you were doing, in fact, we found for every 1% increase in testing you did, you had a 0.5% decrease in your mortality rate if you did this as a log function, so as an elasticity function.
And Duane, sorry to interrupt you here,
sure,
but one thing more on the economic side that intrigued me is that there is, according to your analysis, there is a substantial also money saving.
Yeah.
In terms of also impact on the GDP. That was
God.
1% for testing. Meanwhile, is at 3% according to the IMF. for instance, in the case of Germany?
Yeah, I mean, if you look at this strictly from a policy perspective, what are we doing now? If you lock down a population, that's a 99.99% false positive. So for every 1,000 people, 999 of them will be negative. So that's an enormous economic waste. And what we found was, even if Germany was spending 50 euros per test, and they're manufacturing their own tests, so if we look at the CDC cost per test, it's roughly 50 euros. And you extrapolate that out, they're doing 500,000 tests a week. Even for that spend, it comes out to roughly 600 million a month, as opposed to 50 billion in what you're seeing in lost GDP, according to the IMF. This is illogical economics. I mean, this is unsustainable numbers. These are unsustainable mathematical equations.
I'll come to that with a further question later on, also inviting all the participants that are following us here and are following us on YouTube, that you can leave questions in the question and answer section or through our chat. I just posted to all of you the article that Duane was referring to. But Laura, what we see here, and I'm coming to you, Laura Campos, that is based in Austria and is working for a financial company and has a great background in data analysis. Why would government have such a hard time in testing, of course, but what is the relevance of data? And you said earlier in our private section before starting, I struggled every day with data because it's your job. But what is so complicated also in communicating data to people? Because I have to say that probably even myself, for the first time in my life, I've been following data all day, trying to figure something out, but going to bed always very confused. Also because one thing that we have to say is that the usual data that we get today are about the testing that were done fewer, 3-4 days before. So there's always that confusion. Or today,
it's
many
lagging.
people have died. No, there was a gap there. Yeah. So what is so complicated? And sorry, because I'm not a technician on data. I use data. I mostly rely on you when it comes to data. I rely on people like you. And, I put in my papers references to people like you. So now I know who to blame here. But Laura, coming back to you, what is so complicated about data? Because Duane, very good in presenting, made it very clear. But what makes it so hard?
Well, because as I see, let's say this John Hopkins dashboard, which everyone is referring
very
to.
Funny, I have to say.
Which is, in terms of data engineering, is a huge, it's a huge job. Because imagine that you will receive all this data with different formats all over countries, and who knows the source that they are reporting. Sometimes it's a PDF, sometimes an Excel file, sometimes it's just a Twitter or Facebook or a post. And then you have to follow them, and then you have to program that you will receive an automated, let's say, email or something to yourself, or you will catch this information. But of course, this will be an information with lag, as you mentioned, every time, because daily tracking nowadays is just an imagination or in our heads, because it's not possible to do. So, and imagine all this, and then we're forgetting storytelling about data itself, because again, as our colleague also mentioned, this storytelling is an essential part, because I can imagine, let's say I'm not expert on this data of the COVID coronavirus, but in the data that I'm working always, then I have to ask, what are you really reporting here? What is the meaning of this? And then you discover that people are relying on something and it's not what you're expecting. So for this case, I can imagine, I will say number of positive cases. I imagine in Argentina, they will report the number of where the person was tested and not where the person actually is living, right? So if you think about that, you cannot follow this follow-up of the development of the disease if you don't have a complete data. We'll have not only where, when, also the date, exactly, with this lagging, and who knows if this is 100% accurate, not because sometimes people change their data. And that's with the storytelling, right? And of course, this comes back to the data quality, because as I've seen, and that's because I was clicking all over to see the source, because if you want to explain if you want to start modeling, let's say, you need to come back to where is this data coming from? This is the essential question every time. And when you come back, then you start to discover, okay, as I said, maybe this is coming from a Twitter PDF or who knows where. And this comes back to a central point that is not only about coronavirus itself, but everywhere, which is data quality. Because how can you test, or how can you know if the data is wrong or it is correct? Because at the end, you rely on that. And of course, that has been covered, I think, in most of the countries with contributors, because usually government are sharing this information in an unstructured way. And of course, these people that most of them are volunteers giving formats to this data, doing this incredible job of data engineering, because then you have to imagine how to structure that, and then to deliver a dashboard where people will, will take a look and take decisions based on that. And this is like without end looping, right? Because then you come back to the source and maybe it's not 100% reliable.
But Laura, what is making so complicated? And this is a question of somebody with no technical background. What is it so complicated for governments, particularly when it comes to COVID-19, to find a sort of criteria to work together on this? You know, as scientists, and data science, I guess, follows the same scheme. When we talk about data, there are obviously different benchmark, different models, different way of working. So it's part of the scientific work also to have different ways. But wasn't it better in this case, try to find a common way to analyze data?
Yeah, it's always, well, it's a huge philosophical question about data, because I would say yes, because if you have such a structure, then you can do daily tracking without a problem. Every day I will be the analytical part, I will wake up and I will start modeling on that, relying on the data. But it seems that, I don't know in the rest of the countries, but I imagine Argentina, because I've been working with medical data, and sometimes in a rush, the doctors complete the formulary, usually by manual, they are doing that manually. And those formularies are not all over the country, are not homogeneous, never, ever. And that's the second part where we come, I will say, with people working with data will structure that, but sometimes for sure, it's almost impossible.
I come back to you, Laura, thank you so much. And probably Duane, you have something to add to that, because it seems your work is incredibly structured. But then when I look at that, I said, well, that's done mostly in Germany. So obviously it's well done. And exactly this morning, I was having a conversation. They told me, you should do as those guys were in Germany. And I said, okay, that's why they gave data. We don't have this kind of data. And I started complaining with some of the companies, they shouldn't provide us. They do not give us data here in Italy, but not just in Italy. But let's go to Daniel now. Daniel, you know, I have a strong relationship not with Daniel himself, hopefully in the future, but with this organization, because Daniel is the brilliant mind behind the Liberal Forum in Brussels that covers the think tank. It's a European liberal think tank, the think tank of the think tanks, if I may say. And in the past, he served at the Frederick Naumann Foundation. So we have this very strong liberal background, common background, as I assume with most of the people that are following us. When you look at this conversation, and you are, let's say, the brain of a political party and the brain of a political group of the European Parliament, what is and how can data be used to make policy making? Because the feeling we have, particularly in an era of populism, is we are looking at people's sentiment, but we're not really looking at scientific data. And this is very intriguing. We say, oh, people want this, but then we don't look at data. What makes so hard for policymakers to look at data, and how can politicians instead use data for, you know, a more sounding policy making?
Thank you. First of all, I have to say I'm not the brains of the liberal family. I'm one neuron in the brains of the liberal family. The European Liberal Forum has 46 member organizations, think tanks, and I have great colleagues here that, yeah, think together and try to come up with policy solutions. But indeed, I think right now it's a good moment in time to see how not to do policies based on data to a large extent, and let me come back to that in just a second. And there was something we said in the beginning, and there was, the data is the data. Well, the question for me is always who collects the data. And if you look at the beginning of this entire crisis and looking at China, for instance, or looking at other authoritarian regimes or authoritarian leading regimes, they obviously don't serve out the most reliable data. And there's an old Churchill quote, and any student of statistics will enjoy that very much now, and that's that you can only believe statistics that you falsified yourself. And this is something that we have in mind. So we have, on the one hand, unreliable sources at the beginning that made it very hard to compare numbers. Then, has been said before, we have very different numbers due to the amount of testing. Bulgaria has shortly over 1,000 cases, but the test capabilities are there, well, let's say they're more or less non-existent. So that means for a large point, we don't have a reference point for the data, and we cannot develop a clear and reliable margin of error even for the countries. We don't even have a proper unified system how to count the people who died. So there's this old fallacy in statistics between correlation and causality. Did these people die because of corona, or did these people die and also were infected with corona? This is especially a question that is relevant for the retirement homes, where a lot of the cases of the fatalities unfortunately happened there. And again, looking at data, a new number suggested in France already in December we had cases. Antibody tests from a study conducted in Heinsberg in Germany suggest that it was far further widespread. There's a debate now again about data and numbers, but the Heinsberg study suggests at least that 1.8 million people in Germany have already been infected. So which data is it that we should rely on? And then, of course, also the question, if we have such a hard time relying on data or defining which data we rely on, it's also hard to formulate the policies accordingly. Is Sweden a winning model? Maybe. But the data indeed suggests that there is no one-size-fits-all approach. The question always is how do the measures make sense in the context? For instance, school closing is a big thing. Churches are starting to be open, schools are still being closed. Interesting enough, people who go to churches on average are a lot older than those who go to churches, so they belong to the more vulnerable group, but schools remain closed. Data from the OECD suggests that school closing actually does not have such strong effect like other measures, like social distancing and others. But again, that's also a matter that is part of the cultural context. In Italy, children have a much higher contact rate with people over 65 than in Sweden, for instance. So is it really comparable? Do the measures make sense in the different contexts? But then, and I'm very happy that Laura talked about storytelling, and just one word about that. And there is indeed this perceived data reality and this massive spread of uncertainty about people. People need to make sense of data that they're fed with every day. They only hear the numbers, oh, we have another 1,000 confirmed cases. Okay, what does that mean for me? So it's very hard to actually make sense. And this, then again, talking about the free market roadshow and the liberties, and that's where I want to close, is this acceptance, and again, statistics, that even in Germany, measures of restricting freedoms, even privacy, violations are more accepted now because people feel more afraid. And we can see how fragile our peaceful order actually is. When we see how fast what we thought always that it's for granted, our interconnected economic order just crumbles all of a sudden and leaves room for so much economic and factual nationalism. So is it easy to make policies based on data? If you have reliable data, yes. Do we have reliable data at the moment? No, we don't. And that has been said at the very beginning, and I think that's also very well depicted in the paper.
Thank you, Daniel, so much. I got a little fly coming over me saying Daniel is not just, you know, former Naumann Foundation and now in Brussels with our liberal think tank with it. I was told, and of course, I want to remind that Daniel has also been a great friend moderating a lot of events of the Free Market Roadshow, the European Resource Bank. And of course, he gave us a wonderful, I would say, classical liberal interpretation of the data. But there are 2 points, and I'm coming back to you, Daniel, in a moment to that, because then it brings us to science, to the fact, and I also wrote a bunch of articles in Italian, unfortunately, but on the role of data and science, and the fact that, like in the 30s, we go back to the idea that science is driving policy, but what kind of science? And here in Italy, and I'm thinking about Italy, but anybody has a different experience, we hear a lot, scientists told us that we should do it. Scientists told us that hairdresser, thinking about my hairs, should not be open. Scientists told that we should go to the gym and keep certain social distancing. But Duane, I'm coming back to you, and Daniel and Laura, of course, put together interesting point of view. And one is about the data. Which data are we going to use in terms of policies? Because then we go back to relativism and in the idea there are no good data because there's always a conflict between data, because I can come with some data, you might say, no, I have better data than you have. And second, who's responsible for finding the good data?
Yeah, ultimately the person who's responsible for finding the data is the person who's standing by the data on the research. And we're standing by the data we collected because we went straight to death numbers that were published by reliable sources in states. So we went right to the Department of Health into 60 cities and regions and looked directly at those data. Now, the question is, are you going to get perfect data? No, there's no such thing as perfect data. Do you get enough data where you can get a statistical inference and look at determinations between factors? That is the question, and that's what we were trying to show. Again, there is no such thing as perfect data. There's quality data, and then there's data that's unreliable. Now, the question is, were these people dying of pneumonia who were over 70 years old who were tested positive for COVID-19? The answer was yes. There were a lot of those people. So in that sense, we can stand by that data. We did not use Chinese data. I do not think the Chinese data is reliable. So we avoided sources where we thought that, there was a question there. And ultimately, when you're looking at a statistical inference, you're just trying to find if there's a relationship between two data sets. The data sets need to be good enough. There's always going to be a margin of error. And what we found is when we looked at the national data sets, the margin of errors were too large. When we looked at the regional errors, we were at with the regional levels, the errors were sort of absorbed into the larger things that were having impact. Now, again, the reason why testing worked and was so important is because, we didn't know how many people had this disease. We now, as you've mentioned, the Heinsberg study, the San Francisco study, the Santa Clara study, the Los Angeles study, we're now finding out, what's been happening in Florida. We're finding out that the disease is much more prevalent than people thought. And so that's why when people were testing enough and confirming more cases, the mortality rates were going down, because the fact is we were discovering that actually the disease is not nearly as virulent as people think it is. To try and track and trace now, practically, if we're talking about liberal social order here, if you're talking about freedom and you want to do track and trace now with the disease exposure you have, that would potentially be an enormous violation of civil liberties. But what we've seen in Sweden and Florida is you don't necessarily need to do that. We know who's at risk. There's a certain, can't we rely on people who have risk factors or are 60 or extremely obese or 70 with diabetes not to go out into public, or we isolate them? I mean, can't we just trust people to do the right thing? That's what Sweden, I think, has been doing quite effectively. So again, I think there's a question of perfect data and data that's good enough that you can rely on to get statistical inference. And that was our approach. So again, we don't assume anything. We just look at the data. And basically at the time we were looking in March and April, you know, those people, there was an enormous amount of people dying, and no one, you know, no one knew the scope of the disease. And I think that's what we found, is when you actually determine the scope of the disease, it was much easier to control.
Yeah, and I'm coming back to you later on this. I want to move to Laura, because Laura works as you do with data. Do you agree on this? And which should be the data? Which should be the good data? Is there a good data according to you, Laura?
If there exists in general.
Yes, yeah, you know.
No, I agree. I agree
Laura,
with Duane.
But sometimes I repeat question, and people might say, "Well, Duane has already answered." But you know, the purpose of liberals is also to debate and finding a different opinion. My fear is that too often, and I told Barbara this, too often we agree too much here, and we should not agree too much. That's not in the liberal spirit. So I always repeat question. You know, it's like Einstein, when Einstein was told, why are you repeating the same exam to different classes? They thought he was lazy. You know, as I do as a university professor, I often repeat the same exam, and I use, in this case, because I'm lazy, but you know, Einstein was used to answer, well, because every time answers are different, okay? And here I want to see if there are different answers and try to create a debate on that. Do you agree there are no good data, or we can identify some good data?
Well, for me, this is like digging into the, always for me, is finding where they are supposed. Usually it's like this, like if you try to create a place where you have homogenized data, I don't know if that's the word, you will lose sometimes something, right? Like example, this regional approach, then if you centralize, then you will lose a lot of things. But still, every time that I think about data, I think I agree with Duane in that case. But what I imagine is that you have kind of testing to run to see if you can rely on that. And that has to be always a companion of whatever you're doing. You should have a companion of testing data quality every time. Otherwise, I don't know, sometimes happens that someone somewhere did a typo. I mean, since you're receiving for this kind of information, human manipulated information, right? Where, I don't know, in an Excel file, where it could be a typo, or I don't know, sometimes it happens to me that I receive information from the future. So, but I am usually testing on a dashboard all these kind of things that looks weird, and they come back and then they discover that something happens. Something has been forgotten. Wherever a button over there somewhere happens to be forgotten to be rerun. And but I can hardly imagine that will happen with this kind of information that we are receiving from coronavirus. So because that is even unimaginable for me, you know, yeah. Because there is no data warehouse, there is no database where you're taking information from with a certain structure. And that still that happens even though if you have a certain structure of your data, you will find that there is sometimes outliers, sometimes data in the future, sometimes null columns, and kind of weird things going around this matrix of data, right? And in this case, so if you're, I don't know, taking information from the sources that are so different, then yeah, of course, these kind of things would happen even more.
Laura, I love your description of data as like a human being, like a being that is changing and mutating, and that's beautiful. But it shows that you work with data all day, so in a way, you have to justify that they exist over there. Before coming to Daniel, I want to stop in the middle. You know, I have your 3 images there, and Duane is in the middle. There is a question that came that just arrived from John. John is asking, in New York, a quarter of the population already had COVID, according to seroimmunology studies. Why bother with test and trace when it's already so widespread?
Mm-hmm. Well, first off, you wouldn't know if you had a quarter of the population without doing an antibody test. So, I mean, so that's sort of a self-fulfilling prophecy right there. I think I mentioned earlier, trying to track and trace a city of 22 million at this point. I mean, the the civil liberty implications are probably, I wouldn't necessarily advocate that, nor would we necessarily need to, given what we've seen in Florida and Sweden. Again, I think what that shows is, you can have an intelligent, self-managed policy to, isolate and keep away from those at risk, but yet you don't need to shut down and lock up the economy and lose 3% of your GDP per month. And again, if you go back and look, it's what was, several of the professors and studies that were coming out of Stanford. And I will disagree with Daniel on one thing. We do have a test case that is an isolated control, which is the Diamond Princess. That is rock solid. I mean, literally, that is a boat, a ship with 3,000 people on it that were stuck together for a month. And we know how many people caught it. We know now how many people died. We know the prevalence of the disease, and we know their ages. I mean, we have an incredible laboratory there. And, the Stanford professors and team were looking at that already in March saying, well, wait a minute, and they were drawing conclusions. And then we had the Imperial College study, which went way overboard and said, 2.2 million dead in the United States, and potentially, 4 million dead in Europe. And then everyone sort of panicked and locked down. But if you go back and look what Dr. Dionis was at Stanford and some of those early studies, they were much more sober and much more sanguine, saying, well, look, we see 0.6% here, and the vast majority of these cases are over 70 years old. And what's interesting now is that we're getting more of these serological tests. We're getting more antibody tests. Increasingly, that's kind of where it's ending up. And that's why Sweden increasingly is looking like, the smartest person in the room right now.
It does. I took my PhD in Sweden, so but half in Sweden, half in Italy, so there's some contamination there. Daniel, I'm coming to you, and I had a question about Irina here in the chat, actually, and apologize because I have to go close to the screen because I can't read. I'm getting old too. I should be tested for that. Irina says, great point by Daniel regarding the interpretation of data. We see how data is being or data are misused a lot in countries to impose fear, Bulgaria being one of them. Would it make sense to apply some common regulation in data gathering, analysis, and interpretation? And this is a question that goes to everybody. So I go to Daniel, Laura, and Duane, and then I'm coming back to Daniel because I have a question that concerns liberalism. Oh, the microphone, Daniel.
Yes. So very quickly.
That was not China, it was you.
That was not China, not this time. No, all kidding aside, I have one problem with Diamond Princess, and that is the sample size. And not the sample size, but the sample configuration. And this is then the age groups, but that's a different thing. If you look at the average user of cruise ships and these kind of things, but this aside, I think what's quite interesting and important is from a policy standpoint. I think no matter what the outcome is, the antibody tests that have been rightfully mentioned a couple of times, especially also with New York, show that there has been a quite widespread of the disease. And this must have implications on health policies in the future. So we now are tracking and having antibody tests so we can see how far spread this actually is. We have an approximate indication when everything started, and we now see how fast and how wide the disease can spread. And this must, especially talking about a European context, have implications on the discussions and also with the health regulations that are in place. So the question must be for politicians in the future, what do we make of this data? I'm complete with Duane that we need to look at the data soberly, but what are the consequences? And one of the consequences indeed is, and that's something Irina has pointed to, is that we need some kind, or we have it, a European CDC that is able to devise policies and contingency plans exactly for these kind of situations. We need to know what to do with that. Now we have a case, well, where the mortality rate, fortunately, is relatively low. But what happens if we have a disease where the mortality rate is higher? Yeah. If 3, 5, 10% even, and with which is also similarly infectious. So this must lead to proper health and contingency plans, and also, I must say, to some sort of increased European collaboration in this. European nations are not islands. We were talking before this was starting, how we all go across Europe all the time by car, by plane, and by train. So this must have consequences also, so we don't lose the liberties that we have. That we are in a situation in the future that we are able to contain a situation, to not give room to those who try to stifle our liberties. And last thing I want to say, thank you very much for my professor of statistics back in the day. I always ask myself, why do I study this? Now I know.
For this seminar, thank you so much, Daniel, for doing for that. We'll organize another seminar. I'm learning quite much, but I'm coming back to Laura and Duane very briefly because we're running out of time, unfortunately. Do we need a regulation for this? Now, Barbara will jump in and say, no regulation, but do we need one?
Coordination.
You say coordination.
I would be leery of regulating data per se. I think that could be fraught with peril. Also, then you do run into a situation where data is legally politicized. And I think that potentially could be a dangerous situation. I think what's healthy is having discussions now. You know, I have been very, shall I say, more libertarian on this issue, looking at the actual hard data that we've been looking at some of the findings even before the antibody test, saying, you know, I don't necessarily agree with this lockdown strategy. We were very forward on that, caught some criticism for that early. But I do think it's important that we have these debates. And what Daniel said, I think, is really important. I do think the US does have a CDC that is somewhat lacking in Europe. I mean, you have the WHO, which is a much more pan-global organization, but I still think ultimately it will be a political decision, because the CDC right now, if that decision was left in the United States, you would not be seeing these discussions about opening up. Because I think from a public health standpoint, there's some disagreement there. Even though the data is coming in, there's still some risk aversion to some people in positions of authority who feel that, no, they want to control and they want to sit on this and they want to, you know, not one, you know, we had Mario Cuomo, the governor of New York today, say, you know, every life is precious, not one life should be risked. I mean, so what, are we going to shut down cars? Are we going to shut down airplanes? I mean, you know, we do this all the time. We're making risk value judgments. You know, that's what an annuity table is in insurance. And so, I mean, the idea that, you know, we're not going to risk one life is an absurdity. It's a question of what is the best and has the most value. There's also a huge cost for staying locked down. Alcoholism, domestic violence, suicides. I mean, you know, 30% of the US is unemployed as of today. 24% of Germany is shuttered right now economically. We're looking at a 7% GDP decrease in Germany, the worst recession in Germany post-World War II. I mean, these have huge costs too.
Yeah, thank you, Duane. Laura, sorry if I have to be very brief. We can take some extra time. But do you see any need for regulation?
Well, I think now, I mean, regulation in terms of data gathering is something that, I mean, even though the governments were not able to provide, people volunteering have been doing that part. Is analysis, I think in common, in general, will be very hard, because that will be, I mean, we will lose interpretation of the information, right? So that part I think is not possible, but data gathering, structure, and think of data in terms of one place which is common, you will homogenize your data, it will be the same as structure and being ready to be analyzed. Yeah, I think this should be a common place. Analysis, interpretations, no.
Thank you so much, Laura. Before ending, Daniel, I want to come back to you. And you made a very valid point, but Duane added something to that in a way anticipated my question, because it's also about emotions, and politics is based on emotions. And what we saw here in Italy, probably the country, you know, I have to say, as an Italian, I was not even believing what was going on. And I was behaving more as a Scandinavian, saying, oh, it's just the flu. But then looking at what happened in Milan, that in a way was also bad decision-making, very bad decision-making. But back then, and you know, actually one of the guys that took decisions was a member of the European Liberal Youth, many years ago, and he took probably the wrong decision. But there was much emotion, and 2 weeks ago, our prime minister said, "You are not allowed to. We permit you to." He uses this language that reminded us of a different past. But when we complain as liberals, when we said this isn't acceptable, many people around us, they said, "But you see people tubed, you see people are dying." No, it was very emotional. How politician can combine, rational decision with the emotion of people? And I know you coming from the north side of Europe, I'm coming from the south, despite I've been living most of my time in the north. But you mentioned earlier talking about Sweden, you said Sweden society is very different from Italian society, for instance, in terms of culture. But how can you make this decision? Because this is crucial. At the end, it's a human being taking a decision. And I don't believe our prime minister is a fascist or, communist, but he's not a totalitarian, but he expressed himself as a totalitarian leader.
Oh, there you're opening a completely new can of worms. This is something actually that also the Free Market Roadshow has been discussing over the last couple of years a lot, and also me there in particular, and that is the question of how to conduct politics, how to message in politics, and always the question about this rise of perceived populists all around Europe. I think there's a fundamental problem in political communication. Either you do not explain in a human way or humane way what you want to do and your policies, or you overdo it. So either you say, "Oh God, we will all die," and think of the children, like in this case, or you don't take people with you at all. And there is no middle ground on that. And this is something I think is fueled a lot by the discussion that we have on the media, because there is no time to explain anymore. There's only time to react. There is no time for building a narrative anymore. It's just who comes out the first with a solution or perceived solution. So what I would say indeed is that what politics needs to do is explain again what they are doing in a human kind of way. So populism in the good fashion, meaning coming from populus, the people, and bringing it into an explanatory framework that people can grasp. And the explanatory framework is not the leader standing in front of a nation close to tears saying, "If we do not do this, we will all die," or "old people will die," or these kind of things. Especially for liberals, it must be that you don't treat people as if they were stupid. And you still need to lead. Hard for libertarians to accept, but politics is still a leadership game. And my favorite German chancellor, and I know it's hard for liberals to accept that, 1962, he was the Lord Mayor of the city of Hamburg with a great flood. He explained people, there are things that we have to do now, and I will do everything I can to help people, which he did. So taking people with you without being shrill, that is something that liberals should especially do, and rely on sound data normally, especially economic ones, which would be a fresh wind or fresh breeze in European politics. Listen to economic data and economic sense.
Thank you, Daniel, and you definitely open a new Pandora vase for the next discussion. And I'm challenging here, Barbara, because you also touched the topic of the media, and the media have a lot of responsibility in this. Of course, we have the free choice, we have the free responsibility to watch and not watch and make decision, but that's a matter of education, another topic that we should touch upon. So we saw how data are relevant and crucial, and they also open or interact with different other issue that as liberals we have to challenge in the coming weeks. So we are already extra time of 5 minutes, but people are still there. People are still on YouTube. Thank you very much to Laura, to Duane, and Daniel, not just for helping me understanding, but I assume everybody else that has been following us. Don't forget that our meeting has been recorded and it will be available on the Free Market Roadshow. So enjoy watching it again, or otherwise get in contact with our 3 speakers. Their bio are on the website of the Free Market Roadshow, so you can contact them anytime and exchange further discussion with them, or hopefully, as I like to conclude, as liberals, we have the chance to build our future and therefore to meet ourselves very soon in person, because we still like to hang out in person and maybe talking about politics with a good glass of beer or wine or whatever. In that case, we will measure, you know, the level of alcohol in our blood. And that's a fact, not the data. Thank you so much, everybody, to our speakers. Thank you to Martin, and in this case to Victoria that have been assisting, and to Barbara and Britt that have been helping organizing this great event. Thank you, everybody, and see you next week.